An elderly man with pre-existing medical conditions is the latest patient to succumb to COVID-19. He is the 121st person to die from the coronavirus. The Ministry of Health's latest update on the status of COVID-19 says there have been 19 new positive cases. The number of active cases is now 740. Of these cases, 651 are in home isolation, with 186 in the care of the prison system. At this time, there are 44 patients in hospital, which includes 1 patient in ICU and 1 in the HDU. The Pfizer-BioNTech vaccine could be available in this country once it is approved by the World Health Organization. Currently, the Moderna vaccine, which is in phase 3 of the trial, is included in the COVAX facility, which this country is expected to receive once approved. But PAHO WHO representative for Trinidad and Tobago, Dr. Erica Wheeler, says PAHO is negotiating to have the Pfizer-BioNTech vaccine included in the COVAX facility. Sunilala reports.
Certainly, Trinidad and Tobago, once we are ready, will be able to receive it and at a price which is affordable.
The promise from PAHO WHO representative for Trinidad and Tobago, Dr. Erica Wheeler, after revealing that PAHO is working to have the Pfizer-BioNTech vaccine included in the COVAX facility. Her statement comes after the UK on Wednesday became the first country in the world to approve this vaccine, paving the way for mass vaccinations from next week. If this vaccine is included in the COVAX facility, Dr. Wheeler says this country would be able to receive this vaccine at a reduced price, since it is much more expensive than the Moderna vaccine.
And the Pfizer-BioNTech vaccine is actually the most expensive of all 3, and we have already paid down as a country to receive vaccines at a pre-agreed price. So now PAHO is negotiating to see if we can bring down the cost of the vaccines to Latin America and the Caribbean region.
Dr. Wheeler adds that the World Health Organization will examine all possible data before approving a vaccine, which would give governments a more informed choice.
So if member states say they want a lot of the vaccines, we will negotiate the price accordingly. If they say they want a small quantity of the Pfizer-BioNTech vaccine, we will do so accordingly. Or if some countries say no, they don't want it, and other countries say yes, it will be the prerogative of the countries.
She says different vaccines may have varying effects on people of different age groups, and this is why governments would have to choose which vaccine suits their needs.
But what we did see for the Pfizer-BioNTech vaccines, the type 2, that is the one that's being produced, that it shows like less swelling, less redness, and less, not feeling well after you receive the vaccines.
However, Dr. Wheeler notes that this is not published data, and more information will be shared once it qualifies to be used worldwide. Sonolala, TTT News.